It's interesting about this idea of the different types of trauma, because there are several different types of traumas that caregivers experience. And when you think about it, there actually are three. And specifically now with COVID-19, we've added multiple layers to the kinds of trauma that people are experiencing. So the first one is really basically the trauma that ensues when you actually go through a terrible or distressful event. So a lot of times in the literature, that's talked about as like post-traumatic stress disorder. So individuals that are in the military, they come back from combat, you will see that they have a post-traumatic stress response because of the event that they've had to navigate. So we do know that that's one level. And so even for individuals that are caregivers, many times they also have a myriad of stressful events that they are actually enduring at the moment that they're caregiving. So we know that that happens. The second thing that I would say, the second level of trauma, and one that I don't think gets as much notoriety, if you will, or much literature published on it, is the area of vicarious trauma. So vicarious trauma is that second tier, if you will. And in vicarious trauma, what we see for the caregiver is because of that relationship of providing care to someone that is distressed, creates distress in the caregiver. So it becomes kind of this bi-directional stress that they're holding on to and carrying with them. Even though they didn't experience the event themselves directly, they still experience the emotional and psychological impact of that. So that's another level. So that would be the second. And then third level, and the one that I'm very interested actually right now, because I think it's relevant to the entire globe, is the idea of collective trauma. That entire societies can experience a traumatic event together. And this is a very unusual time in our lives where we have COVID-19. So the entire globe, if you will, entire nations are experiencing the traumatic effect of a larger pandemic that is altering all of our lives on a myriad of levels. So you can imagine if you're a healthcare worker who has to navigate all of these three things simultaneously, the difficulty in just getting through basic daily lives is really impacted. And so this is a unique moment in history where we haven't seen this kind of what I call triple, if you will, triple levels of trauma occurring, I guess, all at once.